Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for the purposes of this course, we will perform CPR on male victims. For the purposes of this video, actors may not always be shown wearing personal protective equipment. Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or product.
Really want us to do well with this presentation tomorrow.
What do you think they'll do?
Well, I hope they'll hire us.
Well, based on your proposal, it'll be a great partnership. Hey, I'm buying. What do you like?
Hey, Anthony!
I remember taking CPR at work, but what do I do first?
Maybe someone else will see if he's okay. I don't know about this.
I know where the AED is, but how do you use it?
Are you okay? Are you okay?
What would you do if you were standing in that line for coffee? Would you step up to help, or would you step back and let someone else do it?
When a person's heart suddenly stops, providing CPR can double or even triple that person's chance of survival. Hello and welcome to the American Heart Association's Heart Saver CPR AED course. In this course, you will learn how to provide CPR, use an AED, and practice these skills all together. To help you along the way, your student workbook covers all the material and includes quick reference guides. If you complete all the course requirements and demonstrate the skills correctly, you'll receive a course completion card. Studies show that you need to review this information and to practice these skills frequently to maintain your ability to respond to a cardiac arrest. Now let's get back to the airport and see how these bystanders work together to save a life.
Anthony, are you okay? Are you okay? Help, I need help. You, what's your name?
Maria?
Maria, I need you to phone 911.
Okay.
I know where an AED is. Good, go get it. He's not breathing. 2, 3, 4, 5, 6.
Yes,
7.
there's a man down on the ground here at the airport. No, he's not breathing. Yeah, we're at Lakeway International Airport, Terminal C, Gate 37, near the coffee shop.
28, 29, 30. I got the AED, but I don't know how to use it. I got it.
Attach pads
Okay,
to
you'll
patient's
call
bare
airport
chest.
security? Yes, a man is doing CPR and someone got an AED. I don't know if I can answer all of your questions, so I'm gonna put you on speaker mode and put the phone next to the man who's helping him. This is the dispatcher.
Can you hear me? We have an AED. I'm attaching pads now.
Yes, I can hear you.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Everybody stay clear. Don't touch him.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR.
1,
Start
2,
with compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
I know CPR.
14,
If you're tired, I can take over.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Let's switch when the AED analyzes the rhythm again. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Analyzing heart rhythm. Do not touch the patient.
Stand back, don't touch him. All right, get ready to take over CPR.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
Paramedics are here. Thank you.
30.
I can take over. Who can tell me what happened?
I work with the guy. His name's Anthony. We were just talking and he collapsed.
1, 2, 3, 4, 5.
When someone has a sudden cardiac arrest, for every minute that passes without CPR or defibrillation, that person's chance of survival falls 7 to 10%. By learning high-quality CPR and how to use an AED, you could help save a life. Now let's look at these terms more closely. CPR stands for cardiopulmonary resuscitation. It's made up of two skills, providing compressions and giving breaths. AED stands for automated external defibrillator. It's a machine with a computer in it that can detect an abnormal cardiac rhythm that requires treatment with a shock. An AED can deliver a shock to eliminate the abnormal rhythm. This allows the heart to resume a normal rhythm. But when and how do you know to provide CPR? Has the person had a heart attack or cardiac arrest? And what's the difference? Sudden cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver, so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when blood flow to part of the heart muscle is blocked. This blockage is caused when a clot forms in a blood vessel that carries blood to the heart. If the blocked vessel is not reopened quickly, the muscle normally nourished by the vessel begins to die. A person may have discomfort or pain in the chest or an uncomfortable feeling in one or both arms, the neck, the jaw, or the back between the shoulder blades. The person may also feel short of breath, nauseated, sweaty, or extremely tired. A heart attack can lead to cardiac arrest. When CPR is needed, compressing the chest can help blood get to the brain and other vital organs. We'll talk more about providing chest compressions and the proper way to do them in just a few minutes. First, it's important to know that when you provide CPR, you're taking part in the American Heart Association's adult chain of survival. This chain of survival shows the most important actions needed to treat cardiac arrest. The first priority is recognizing the emergency and phoning 911. After recognizing the emergency and phoning 911, the second link in the chain of survival is early CPR with an emphasis on compressions. This is followed by quick use of an AED, effective advanced care such as that provided by emergency responders and hospital providers who can give advanced support and post-cardiac arrest care. It's important to get help. Seconds are ticking away. In this course, you'll learn how and when to phone for help. Wherever you are, taking action starts with you. When faced with an emergency, you may be hesitant to act like some of the people we've just seen. But it's better to provide CPR to someone who doesn't need it than to not provide it to someone who does. And often, you're not alone. People around you generally want to help. An emergency can quickly become a coordinated rescue with everyone working together until someone with advanced training arrives and takes over.
Yes, there's a man down on the ground here at the airport.
Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher will likely ask about where you are and what has happened. Dispatchers can provide instructions that will help you, such as telling you how to provide CPR, use an AED, or give first aid. That's why it's important to put the phone on speaker mode after phoning 911, so the dispatcher and the person providing CPR can speak to each other.
This is the dispatcher.
Can you hear me? I'm just unsure if I did the right thing.
Oh, you did. You did great. By providing CPR, you helped your friend until we could get here to take over. 20, 21, 22, 23.
After an emergency, you might have questions like Gene did. Did I do the right thing? Should I have done something differently? Did I do CPR the correct way? It's natural to hesitate or to question yourself and your abilities. This training will help empower you and help you overcome your hesitation to act. It's better to act than to do nothing. By taking action, you're increasing the person's chance of survival. When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds for us to realize that this is actually an emergency. When we do, There are steps to follow in determining whether or not a person needs CPR. Before you start providing CPR, you need to make sure the scene is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, you need to check to see if the person is responsive. Kneel at his side, tap him and shout, "Are you okay? Are you okay?" Someone who is responsive moves, speaks, blinks, or otherwise reacts when you tap him and ask if he's okay. Someone who does not move, speak, blink, or otherwise react is unresponsive. If the person is unresponsive, shout for help. Here's a demonstration. While leaning over the person who is down, check to see if the person is responsive. Tap his shoulders and ask, "Are you okay? Are you okay?" If the person does not move, speak, blink, or otherwise react, then he is unresponsive. Shout for help. "Help! Help! I need help!" If someone is nearby and can help, have that person phone 911 and get an AED. Say, "You, phone 911 and get an AED." If no one comes, then phone 911 yourself. In an emergency, the sooner you realize that there's a problem and get help, the better it is for the ill or injured person. When Gene didn't get a response from Anthony, Gene asked Maria to phone 911, and Mark offered to get an AED. Gene then performed the next step in assessing the need for CPR. He checked for breathing. It all happens quickly, but this is important. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Then move the clothes out of the way to bare the chest. If a person is gasping, it usually looks like he is drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Agonal gasps are frequently present in the first minutes after sudden cardiac arrest. These gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. Gasping is not regular or normal breathing. It's a sign of cardiac arrest in someone who is unresponsive.
Someone who's agno breathing like that needs CPR right away. It's a telltale sign. I've seen it working on the job and doing CPR as a layperson.
It's important to recognize cardiac arrest as quickly as possible. CPR keeps a person's blood flowing until other medical care can be given. Let's look at these steps all together in assessing the need for CPR. Before you provide CPR, check to make sure the scene is safe and make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. "Sir, are you okay? Are you okay? Help! Help! I need help!" If someone comes, have that person phone 911 and get an AED. You, phone 911 and get an AED. If no one comes to help and you have a cell phone, phone 911. Put it on speaker mode so you can hear the dispatcher's instructions and begin CPR. You will also need to get the AED yourself. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. The video will now pause while you get in position to practice scene safety and assessment. It's important to consider the position of the ill or injured person before providing CPR. If the person is breathing normally and is unresponsive, this person does not need CPR. You can place the person on his or her side until someone with more advanced training arrives. To provide high-quality CPR, you do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. Compressions are the most important part of CPR. However, high-quality CPR has 2 main skills, providing compressions and giving breaths. We're going to demonstrate both and give you a chance to practice. When providing compressions, it's important to push hard and fast on the chest. So let's just focus on compressions right now and take a look at how they should be done. A chest compression is the act of pushing on the chest. When you push on the chest, you pump blood to the brain and heart. People are often afraid of causing injury to a person from providing compressions, but injury is unlikely. You need to push hard and fast at a depth of at least 2 inches and a rate of 100 to 120 compressions per minute. Let's watch this demonstration, then you'll get to practice. You can follow along with what's on the screen as you provide the compressions yourself, and then we'll switch students when the video instructs you to. Each student will perform 2 sets of 30 compressions. And remember, we'll be providing compressions at the rate of 100 to 120 compressions per minute, while counting them out loud. Make sure the compressions are at a depth of at least 2 inches and allow the chest to come back to its normal position between each compression. Our aim is to minimize interruptions in chest compressions. These interruptions include those needed to deliver breaths and as you take. Now we're going to learn the second skill of providing high-quality CPR, giving breaths. Before giving breaths, open the airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. As you practice this skill today, you'll be doing so on a mannequin. Remember, you don't want to interrupt compressions for more than 10 seconds to give breaths. To open the airway, follow these steps. Begin with your hands on the mannequin's chest, because you will always be giving breaths after compressions. Put one hand on the mannequin's forehead and the fingers of your other hand on the bony part of the chin. Then, tilt the head back and lift the chin. This simple action lifts the tongue from the back of the throat, opening the airway. It's important to avoid pressing into the soft part of the neck or under the chin because this might block the airway. While holding the airway open, pinch the nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give someone a breath and the chest doesn't rise, allow the head to go back to its normal position. Then open the airway again by tilting the head and lifting the chin. Then give another breath. Make sure the chest rises. Don't interrupt compressions for more than 10 seconds to give 2 breaths. The video will now pause while you get in position to practice giving breaths. You'll try 3 sets of 2 breaths, and you'll start and end each time with your hands on the mannequin's chest. Get ready. 3, 2, 1. Starting with your hands on the mannequin's chest, move to open the airway. Put one hand on the forehead and the fingers of your other hand on the bony part of the chin. Tilt the head back and lift the chin. Hold the airway open. Pinch the nose closed and take a normal breath. Cover the person's mouth with your mouth. Give a breath for 1 second. Give a second breath, blowing for 1 second. Again, watch for the chest to rise. Go back to the compressions position. Okay, try again. Tilt the head back and lift the chin, and pinch the nose. Give a breath. Give a breath. Okay, try again. Tilt the head back and lift the chin, and pinch the nose. Give a breath. Give a breath. Go back to the compressions position. You may give breaths with or without a mask. If you're in the workplace, your employer may provide personal protective equipment, including pocket masks for use during CPR. There are many different kinds of masks and face shields, and there are different sizes for adults, children, and infants, so make sure you're using the right size. Your instructor may also discuss other types of devices that can be used when providing breaths. Masks or shields are made of plastic and fit over the person's mouth or mouth and nose. You may need to put a mask together before you use it, but this is usually as simple as popping it into shape and attaching the one-way valve that goes with the mask. That's the part you breathe into. So let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with a mask. Start out kneeling next to the mannequin with your hands on the chest. put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put the narrow part of the mask on the bridge of the nose, and the wide part of the mask should cover the mannequin's mouth. Tilt the head and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. After giving the breaths, go back to the position to give compressions. Remember, if you give a breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises this time. Interrupt the compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Now we're going to practice using a mask to give breaths. By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. Let's go back to our scene with Gene and Anthony. We'll pick up just before the AED arrives.
28, 29, 30.
I got the AED, but I don't know how to use it.
I got it.
I don't know if I can answer all of your questions, so I'm going to put you on speaker mode and put the phone next to the man who's helping him. This is the dispatcher.
Can you hear me? We have an AED. I'm attaching pads now.
Yes, I can hear you. Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Everybody stay clear. Don't touch him.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. When sudden cardiac arrest develops, the heart quivers and stops pumping blood. A shock from an AED stuns the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you will hear prompts telling you everything you need to do. AEDs may have adult and child pads. Make sure you use the adult pads on anyone 8 years of age or older. Peel away the backing from the pads, following the pictures found on the pads. Attach the adhesive pads to the person's bare chest. If the AED recommends a shock, it will tell you to stay clear of the person. If the AED tells you to clear the person, then loudly state, "Clear." Look to be sure no one is touching the person just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. Following this demonstration, you will have a chance to practice using an AED trainer, just so you can see what it's like. You'll start with your hands in place to give compressions, and the AED will arrive immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay, everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay, everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
You'll need to consider a few special situations when using an AED. First, if the victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. Water on a victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that AED. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. AEDs can be used for children and for infants too. Many AEDs have pads for adults and a child pad cable system or a key. But if there are no child pads, or if there isn't a child key or switch, use the adult pads. Also, if the child is 8 years of age or older, use adult pads. Now we're going to demonstrate how to put it all together, from scene safety and assessment to providing compressions and giving breaths to using an AED. Afterwards, you'll get a chance to practice. First, check to make sure the scene is safe and make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. Sir, are you okay? Are you okay? Help! Help! I need help! And ask someone to phone 911 and get an AED. You, phone 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. Now, tilt the head back and lift the chin to open the airway and give 2 breaths with the mask. Remember, do not interrupt compressions for more than 10 seconds. Repeat. Now, tilt the head back and lift the chin and give 2 breaths with the mask. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay. Everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay. Everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
I brought over the proposal, and I need for you to tell me what you think.
All right, let's take a look.
If you look at page 2, there's a high-level view of the company. Actually, you know what? I think I have my own copy. Right here. Are you choking? Can I help you?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding his throat. If this happens, you need to act right away to try to clear the airway. When a person's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and it's severe, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrust should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. Watch and see how this might happen and what you should do.
Sir, can you help me lower him to the ground?
Phone 911 and get an AED.
When a choking adult becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. But do not perform a blind finger sweep, because the object may become lodged further back in the airway. Each time you open the airway to give breaths, look for the object in the back of the throat. After checking the mouth, give 2 breaths and then repeat 30 compressions. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
When did Timothy's mom say she was coming back?
Well, she's swimming laps in the pool now.
So half hour?
That'd be about right. Okay, guys, let's share. Let's share. All right. That looks like fun.
Timothy?
Sherry, what's wrong?
There's something wrong with Timothy. He doesn't look right. What do I do? What do I do?
I remember from CPR class.
There is nothing more frightening than when something happens to an infant. But with the training you received today, you'll have the skills you need in emergency situations like the one you just saw. Hello and welcome to the infant CPR portion of the American Heart Association's HeartSaver CPR AED course. This course will help you learn in several ways. Your student workbook covers all the material and includes quick reference guides. And this video will give you facts and show you important skills. If you complete all the course requirements and demonstrate these skills correctly, you'll receive a course completion card. Studies show that you need to review this information and practice these skills frequently to maintain your ability to respond to a cardiac arrest. Now, let's get back to the Child Care Center and see how training in CPR can help you save a life.
Oh, okay, let me have him. Timothy? 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 Sherry, phone 911. Trey, get the first aid kit. Lisa, would you move the kids to another area, please? And find Timothy's mom. Okay.
We have a baby that is unresponsive.
He's not breathing.
No, we don't have an AED.
1, 2,
The address
3.
is 149 Barnard Street. Yeah, I can meet them up front and bring them back here. Okay. Okay, I'll do that. Brenda, I have dispatcher. She asked me to put the phone on speaker mode here beside you. I'm gonna go wait outside for paramedics.
30. Come on, breathe. 1, 2, 3,
I'll take over
4,
compressions on the
5,
next set.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Timothy! Timothy, what happened?
Okay, I'm taking over compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9,
That's good.
10,
How old
11,
is the infant?
12, 13, 14,
6
15,
months.
16, 17, 18, 19,
We phoned
20,
911.
21,
The paramedics
22,
are on the
23,
way.
24, 25, 26, 27, 28, 29, 30.
Can you tell me what happened?
We don't know. He was fine 1 minute, and the next
2,
minute he wasn't
3,
moving.
4, 5, 6, 7.
His mother's
8,
here.
9,
Does
10,
Timothy have
11,
any medical
12,
issues?
13, 14, 15.
No,
16,
not that I'm
17,
aware of.
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Remember to
12,
push hard and
13,
fast.
14, 15,
About an inch and a
16,
half.
17, 18, 19,
Nothing like this
20,
has ever happened
21,
before.
22,
He was fine when he
24,
came
25,
in.
26, 27, 28, 29, 30. 1, 2, 3, 4, 5.
Just as in older children, when an infant's heart stops beating, blood stops flowing through the body. When you push on the chest, you pump blood to the brain and heart. For the purposes of this course, an infant is younger than 1 year. Because infants are so small, there are some differences between infants, children, and adults in how CPR is performed. When providing compressions to an infant, you use just 2 fingers of one hand versus 1 or 2 hands for a child and 2 hands for an adult. Also, for an infant, you should push down about 1.5 inches at the rate of 100 to 120 compressions per minute. To provide high-quality CPR, you do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. In providing high-quality CPR, pushing hard and fast when providing compressions is just as important with infants as it is with children and adults. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Move clothes out of the way to bare the chest. One of the main differences in infant CPR is that you use just 2 fingers in providing compressions. Watch this for placement of your fingers on the baby's chest. Put 2 fingers of one hand on the breastbone, just below the nipple line. Let's look at placement of your hand again. 2 fingers go on the breastbone, just below the nipple line. Press the infant's chest straight down about 1.5 inches. After each compression, let the chest come back up to its normal position. You'll need to give compressions at the rate of 100 to 120 compressions per minute. Infants often have healthy hearts. Usually when an infant's heart stops beating, it's because he can't breathe or has trouble breathing. Therefore, it's very important to give breaths as well as compressions to an infant who needs CPR. When giving a breath, opening the airway correctly will help keep an infant's tongue out of the way. Opening the infant's airway too far can actually close the infant's airway, making it difficult to get air inside. Follow the techniques you're about to learn to make sure you open the infant's airway correctly. So let's look at the steps for opening the airway and giving breaths to an infant. And remember, this should be done quickly during CPR, never interrupting chest compressions for more than 10 seconds. We'll show you how first, and then you'll get a chance to practice. Because you will always be giving breaths after compressions, begin with 2 fingers of one hand on the mannequin's chest. To open the airway, follow these steps. Tilt the infant's head back by pushing back on the forehead, and put the fingers of your other hand on the bony part of the chin and lift. It's important to avoid pressing into the soft part of the neck or under the chin because this might block the airway. Also, don't push the head back too far. This might close the airway as well. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise. Infants don't need as much air to make the chest rise, but you'll only know the infant has gotten enough air if you do see the chest rise. After giving the breath, go back to the position to provide compressions. Let's watch one more time. Tilt the infant's head by pushing back on the forehead, and put the fingers of your other hand on the bony part of the chin and lift. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. Watch for the chest to rise. After giving the breath, go back to the position to provide compressions. If you have difficulty making an effective seal, try either mouth-to-mouth or mouth-to-nose breaths. If you use the mouth-to-mouth technique, pinch the nose closed. If you use the mouth-to-nose technique, close the mouth. Sometimes you'll find that your breaths aren't making the infant's chest rise. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position, and then open the airway again. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Remember, in giving effective breaths, it's important to minimize interruptions in compressions. You should give the 2 breaths in 10 seconds or less, and remember to blow for 1 second. You may give breaths with or without a mask. If you're in the workplace, your employer may provide personal protective equipment, including pocket masks for use during CPR. Masks are made of firm plastic and fit over the infant's mouth and nose. There are many different kinds of masks and face shields, and there are different sizes for adults, children, and infants, so make sure you're using the right size. You may need to put a mask together before you use it, but this is usually as simple as popping it into shape and attaching the one-way valve that goes with the mask. That's the part you breathe into. Your instructor may also discuss other types of devices that can be used when providing breaths. So, let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with a mask. We'll start next to the mannequin, with your fingers in place to provide compressions. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put the narrow part of the mask on the bridge of the nose. The wide part of the mask should cover the mannequin's mouth. Tilt the head and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. After giving the breath, go back to the position to provide compressions. Remember, if the chest doesn't rise after you give a breath, tilt the head back and lift the chin and try again. You should try to give 2 effective breaths within 10 seconds. Now we're going to demonstrate how to put it all together, from scene safety and assessment to providing compressions and giving breaths. Afterwards, you'll get a chance to practice. First, check to make sure the scene is safe. The scene is safe. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Tap the infant's foot and shout to see if the infant is responsive. Baby, baby, are you okay? Are you okay? If the infant is unresponsive, shout for help. Help! Help! Somebody help! If help is nearby, have someone phone 911 and get an AED. You, phone 911 and get an AED. Check for breathing for at least 5 seconds, but no more than 10 seconds. If the infant isn't breathing or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. Now, place the mask and open the airway and give 2 breaths. Watch for the chest to rise. Repeat. Now, place the mask and open the airway and give 2 breaths. Watch for the chest to rise. Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant on his back, supporting his head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up onto a firm, flat surface, then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out, the infant starts to respond, or someone with more advanced training arrives and takes over. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. You've learned how to assess the need for CPR and phone 911. Now let's focus on compressions and how they should be done. It's no different than with adults. CPR for a child, pushing hard and fast on the chest, is the most important skill you'll learn. To provide high-quality CPR, you do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. Chest compression is the act of pushing on the chest. When you push on the chest, you pump blood to the brain and heart. When providing compressions on a child, use one hand for compressions. If you can't push down about 2 inches with one hand, use 2 hands to compress the chest. Sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. Let's watch this demonstration and then you'll get to practice. Make sure that the child is lying face up on a firm, flat surface. Position yourself at the child's side. Move the clothes out of the way to bare the chest. Use one hand for compressions. If you can't push down about 2 inches with one hand, use 2 hands to compress the chest. Put the heel of one hand on the lower half of the breastbone. If you are using 2 hands, put the heel of your other hand on top of your first hand. After each compression, let the chest come back up to its normal position. Compress the chest 30 times at a rate of 100 to 120 compressions per minute.